Ekosiisen nie bonso a wo mene sempa de brane mamba obi so
Asomo asempa 94.7 FM. Ekosiisen dwumedie no asoguso a wotie no. Check with your time 18 minutes after 3. Ebeda Ora William Boateng ase oye Director Communications for the Electricity Company of Ghana ECG. And amotesi no ADN come. Ebesra mo say mo message is bebre na by to me and kind I would try and bring him back na afe no atwa so ECG issues amowo and adeba. We have to move on to another very important conversation and a landmark event akoso ewo yemai emo. It's the launch of Mahama Cares, a flagship health sector promiser. His Excellency the President, as leader of the opposition party then, Ghana for Ejitomo to Abamano, Nyamiadom, Wapao Hontoma, and the minister in charge of the sector, Kwabanaminta Kando, MP Joaboso constituency, Wabekansa, Honorable Bokode.
Nyamini madaro maboko.
That's it, yeah, kakra. Well, congratulations. I mean, after vet and then the swearing in the I mean, share Dana intimate Kasai. Congratulations. I think you've done very well for yourself. I mean, you've done very well from regional youth organizer.
Yeah.
You've done very well for yourself. Congratulations. Congrats. Good. Inti, let's move straight.
Good.
Mahama Cares. Mapa hon to Mary.
The Pachamani.
There.
Okay. Obi, Mahama Cares, a fund for tour. Bia. You are John Dramani Mahama Brad or Bon Toa, our Ghana, Memono. Who say, your Yarua Binim Wa say a bonipa, a nipano a cook him, and I say, oh, Sanya Mammy anyway, that's how I ran no, a nipanicum. Into an argument of a pehop messibre. Na yape for tour beer, say nipper beer, but Obinya Sayan, you bet me dear Buano. Yareni bini Yarwa Bensa, cardiovascular disease, a bit is a acomayare, a bit is a cancers, a bit is a kidney failure, and it's a nemano. A boa, a binu wa, Unya Sayarena, Okua enye. So what I said, you're managing. In the first place, no. Safia and you see a baby be a friend of free primary health care.
Okay.
It is our free primary health care, no so no. You be shall see a free a see ho. Send you be ya. Nipa beti me abon ho buying a dear free sign in the first place. You be creating awareness. Send you be ya nipa beti me testing or BPs or me check on sugar levels regularly. Nipa beti me exercise na a expert in the field and be to me a 2 amount for a coin be for so I'm sure who Nemo we nyina echi no nyame amfa fie na obinya yare ni bia ekwan be ne be fa so a nipa no betumi anyini ache mpembe bre no complications ne ba ebi also yes surgery statistically no na say so via ya kire say about 53,000 Ghana cedis and now one munya sa condition no almost spending on now we afeni mu nyina no we income crisis obi o wa onya yare na obi obeto ni hoja pade nyina enne he says the president can story be ono ankofo onim wonom na oboa wonom ade ready nipa ni wo but obe wo no aton ni ho bibia aton ni TV aton ni car aton ni bibia ansa no be wukura wose yawu ntino ye de for two way eba sani ebeya nkofo binim omo sa atebia ni mu no ombetimi anya so mfaso obi it is not far from you it is not far from me abusua bia ni wa sayare bi nim abusua bia ni wa sabe unhu so obi wa pressure stroke okoya stroke anasa wa koma yare anasa cancer bi and any prominent people in this country omunya sayare wa bi ntenya bowa wa busua ni nyina no wanhwe yi a na ohia podo ena yishemu kakra ya yenso kire se owu a ekoso mortality a ekoso samre no emu bebre na about 43% or how much mu edumiensa eyesa yarewa we mu nti NCDs yare non communicable disease no owu a de ba no ekonanim every serious country biano I was say we be fa ho and obi ade ba ko e be san ache wa adwene say anka yenim say yare wade nipa nyinia kodu baabi na immune system no kra ko down na we say we yare but rejemu aye kire say omo yare ni nyina emu ba fa between the ages of 18 to 45. The most productive wing of the population. Omo be di adwuma na omo timi kuntu abo manim no omo na omo run obi wa dialysis je o be 3 times a week or something like that. Obi wa koma yare obi wa diabetes ontumi nko ba bia na one year diabetes ni pressure ni be boom and so ma be before
and also na cause kidney
exactly now kidney na afeli na da bia no ad hoc na knee jerk reaction you say kolebu for omatomurina unity mu ye nyesika anye we until we must find a permanent solution to that particular issue hence Mahama case nyame ya daroma akwan be na be fa so a ye be nyesika Sisia no task force no awie de omo report aba ene ka ho asem ya ya bill awie anyankopon ya adomo a recess omo fuwa ya pass bill into act nyame adaroma national health insurance no and let me make this point as my national health insurance there no yare bia national health insurance na cover enka Mahama case ho
in this ha eno de NHIS be cover
that. Jeno nka ho. Nti de Mahama case en cover no.
The national health en cover.
Sorry. The national health insurance en cover no. And na Mahama care be cover. Now you who say abinda da no. No why be a friend capping of the national health insurance fund.
Yes.
Nyame da wo ma John Dramani Mahama ayi sa capping afro. No so look. Me yefu on sika na eba no. Me mfa nko ba bia. I'll still spend it in the health sector. So I say into free primary health care mumfabi USAID for no boy ma withdraw wonom assistance nyina no mumfabi nso enye dey enye na Mahama case nso emfa nkae no mfabi nti ye wie no a ne yesi ahwe mmea ahodo a yebetime nya sika more abeka eno ho ba bi te say corporate Ghana and na twe wani behwe ye wie no arosekra gumi amafo mo ebe donate pensioner Professor IT owie no compare ye betu din owie ya e ka so ma brief remarks or ma brief remarks wie ya pe say Mr President me ni bi nti me check kitwe je na mo fa moa ni em be betu din kwa Mr President or dey check ni ma me or dey check ni ma me na me tena ase ye tena ase na Mr President age check the film say some person me hwe pensioner ye ko hwe ya wa maye $1,000 now secret go me $1,000 and ye dem wo we sun metua Mr President nankasa mu o say controller nyantua ne ka na mo say controller tia ne ka dia ono ne 6 months salary
or the
boafoto no
6 months
salary now boss say what the 6 months salary now what you now dey intimacy me the 3 months salary at the bois
but won't mean go beyond the
boss of course the other ministers were there honorable Officer Jare Namumo gender minister no obuso nyina pledge 1 month salary 1 month salary and GMA Ghana Medical Association am I 100,000 Ghana cedis nurses am I 150,000 Ghana cedis this association pharmaceutical industry and people they were pledging
into the fund
they say no within the next 72 hours no the short code baba bonting so the beya obia and you see we did a very interesting survey near no about 79% of Ghanaians say sadi we hu pa and obia relate because obuso ni bi anya say be and the interesting aspect is that so are willing even to contribute. They are willing to contribute.
I recall, sir, when the conversation around even COVID levy, not exactly those times.
Yes,
Ibikra suggested and Kayen converted into a tax for a fund like this.
Exactly.
It can also be part of the conversation.
And I go for it. And Obi, remember Sakwanya way. and nankrofo no wase yet committee be from Mahama Cares Task Force.
Mahama Cares Task Force. Okay.
And Omaya Jumasum. I mean, medical doctors, I mean, with their specialties and what have you. Professor Binka, Professor Aite, Grengon, about 9 of them. They've done wonderful job. When you say make office and do 3 months, so you have to do a policy, you have to do a bill, and as this, I say that must not affect your day-to-day running. It was not easy, but made that Professor Aite committee in ASEPA. Quite apart from that, ordinary Ghanaians are more responding, especially in the survey, are more interest in whatever we are doing. Also, me directors at the ministries. Our musu kuomo our mama and the who the hu almost a better almost me via afe His Excellency the kofare by nankasa John Dramani Mahama na hu mo bronti odwe sa de we hu akofa ba no ye better na se na me nim say enne ene nchirima nyina ewe mfini de bia da was sa de we ye enne ya pa ho ntoma no
me were 2 questions. Number 1 will be say, and I like the idea about having something sustainable. I am quite knee-jerk one off a day.
No.
But I am a bit worried.
Okay.
Because we are in an excessively partisan environment. The name of the fund alone, Ekonoti partisanship, Mahama Cares. It might not outlive Mahama as president.
Fantastic and legitimate concern. Ono Krampono. So with this speech, no Drew, no, I say he doesn't feel so comfortable mentioning it. But Obamacare, for example, you need deeper in Obamacare.
Sure.
So what I say, we need deeper,
affordable care.
Fantastic, but you'll be a friend of Obamacare. We deeper Ghana Medical Trust Fund. Ghana Medical Trust Fund.
Okay, GMTF, Ghana Medical Trust Fund.
Ni deeper no, popularly known as Mahama Cares, and the Mahama Cares. That's on the lighter note.
The Ghana Medical Trust Fund. Yes. And again, so the sources of funding.
Good.
And yes, I better take a decision to uncap.
Yes.
NHIL levy and Sika Nanka from the capping equating to consolidated fund.
Yes.
Is there more channel the back health?
Yes.
But that would also in the long run affect NHIS. And
say ye pa affect NHIS. NHIS the botaye pa ne de hin. Say anka ye binya ngiyare bia se ne obi TB obeyare bia anka ni ayare hwe na wo se hwe no. So what I say. Inti se enne ye de foto bi aba ye kusa kope bisika bi afri baabi di aka ho ne ye aye sa adwuma na anya de abe. And ordinarily aninti sanka ye de sadi we ko ka bed we ko ka national health insurance na ho dia ka me no be ya adwen say e be affect no because that bed na yekese sika no so the same source but emom ye yi kakra afri ho ni ba ko pe ebi afri baabi e de abeka ho e de akoye ayarehwe. But because our national health insurance scheme now, every year by year, they increase the diseases on the list. In the bedroom, baby, no sustainable beam. In the chronic disease treatment, we know are very expensive. You can say, didn't know a cock go
NHIS no so
be collapse no. There is idea and the caneno near capo, you need a cap nibi. Near copy being free baby for. Do share bill anymore? You define clearly the sources. I mean, from the extractive industry, the telcos, the corporate Ghana, and all those. I mean, places. No, near copy a transfer free national health insurance near the Abeka home. But
I recall one common and dominant even time and we are ranking member on health. Was said NHIS na omu kem. Adi ano omu kem ne say
good.
Omu sick and ne akape.
Yes.
Inti. That capping alone not a deny NHIS of some sika no mu hia de aye adwuma. And the senyamia domna say ya on cap here. Why won't we allow NHIS to have their money and find another means of funding the affordable Mahama Cares funding?
So Osha na makacho no even on cap no enye nyina ene ye de ko Mahama Care care.
Sure.
But to that,
yes.
Into a baby flow international health insurance anyway. But what I say, for example, primary health care. National health insurance is primary health care.
It will be part.
It will be part of way no. So, but see a case, ele yarewa ni edekoshe. Between the fact say, young fast I know when you uncle go national health insurance so, and they say, yen national health insurance in sika kakra. Ni uncle pe be free baby. Ni ba meka ho. Ni yen sustainable name yet because bu o manya. Emre bia ni de sie bia ni ehun anamontua wo se wotuo. At this point in time, you say, how can by NCDs? Non-communicable diseases. At the moment, that's our major challenge in this country. Look, Obi, I can tell you so be more pressure on him or pressure.
Yeah.
I can tell you on authorities so be more or diabetes on him or diabetes. By the time of no.
Now it drew end stage, no.
Now I very complicated. So we must deal with this swiftly. In the end, to me, we must be innovative. Think outside the box. Be any decision, be any way take care by being suffer kakra. Also, open take a decision, be suffer, you can't have such a decision. Under the circumstances, Obi, me feel say it is the wisest and the most prudent decision we have taken so far. What I say, and it is not only the uncapping aspect.
Okay.
So kaya. Those days, now they back when I'm attacking one the delay in the payment of the claims. And now we are all on the same page with the National Health Insurance, the Ministry, and the Ministry of Finance that we are not going to entertain this delay. The quite recently, backlogs of home Jiro Bia Yakuri the claims there. I'm clear.
But delay would mean what? Because the law envisages say at least 3 months lag be ebeba vetting claims.
So we are not even going to, wait until 3 months.
Okay.
Until you be per the conversation we've had amongst ourselves, and be every month to be across a clear.
But that would be a tall order.
Yes, and we are determined to do that. It's a target we have set for ourselves. Because Obi, don't forget that we are having a conversation around free primary health care.
Yeah.
Now, free primary health care, no, usually, no, the chiefs and then the healthcare centers. Almost, internet generated funds, no, and yet the BR substantial. Yeah. So if you don't do prompt payment, what it means is that you kill.
Yeah, primary healthcare policy.
But what I say. Yeah. So we have targeted say, and you might need to do 3 months, no, you may prompt releases. So
and the primary healthcare for because I don't know, I see say. And then will be more in the CHIPS compound. Health centers, and the district hospitals.
And no, identify NCDs at its early stages. Near dealing with it. A binum wa say to me, winning Temoa, it me swano, ain't grow to this level. Inti say bia, your baby be near chest, okay, you better check your sugar level regularly or pressure. It be cry, you be a bit say navigators nkophobia or you bit me do more akọ dwom until te kwa to wa de ko bit me aba na be check o BP ni ade e bit me mobile vans too. Bring the healthcare closer to the people. Sani man ya ni aso anon term in fact Mr. President Krasa just says some medications, we should be looking at encouraging our pharmaceutical industry to produce our local ones so that they are born better in a form. This is what we are looking at.
It means they say under primary health care policy, CHIPS compounds near the Ebeshenko food. Almost where the NHIS claims in the home. Okay. But that's why I'm yes coming
to deal with those things. And that's why a certain proportion of SAR capital must go and add on to the previous national health insurance so that I'm taking care of those things as well. So
okay, and one other thing they say obi ojuabo so na otio. Sisi ade what things so man panyin apa Mahama cares hontoma. Ono nso e bia o ye babunu ne maame pressure eba yenye ne omo treat what say Mahama cares apa hontoma. Sa nipa no so benefit a onye den.
I was say o ye Ghana ni de kan.
Okay.
Na se ne masi aka no very soon the code near the idea but the same processes are
to benefit from the fund.
Yes. Nti dedika I was say oya Ghana ni.
Okay.
I was say oya obia or suffer from these diseases we have mentioned. Ansana yebeka so be suffer from these diseases no. I was say a medical practitioner a diagnose you say when you say at least nipa be me you know.
Okay.
Near satisfied minimum bia or call hospital na your man or pressure drew or call for second opinion ye a drew difference pressure it be no condition be no at the time into no you feel say anka anye ye cry no a two medical practitioners and be confirm say oh sa condition ni bi afi ye nya sa de ni wi a wo be fill Mahama Care Fund application form okay and no medical doctors no ebe boa because it will be available afi na medical document bia o bia no o de aka ho na wa submit it to Mahama Care application to the Mahama Care Fund no ma review application review application maximum days are enko binyon abetchom kai within 2 weeks
okay
na ye bota ne say anka be ya nge bedu ba bi ebetwa ya magana ni bia but obi the truth of the matter ne say you say opam watade ade o material na fabric ne be so no na de be pam nti sika na ye benya no ene kwa be fa so be de ye bedi no nti ye kwa ni nya sika ne bebre a no bia enya bia but obi of course se sabe impreduous asonam deka muti ha ise wenya sa ya we ne bi no obi e wo hwe me ha I want me consistency no so ya we ne bia you should expect say e betu so say e be boa than obi but what I say e ba say was say Ghana for ye dey eti ase e be do baby no na be universal oh you were enough funds I be I take care of baby so that is why there's a need for somebody to apply. And yes I didn't application in here
but for now because of funding constraints there was application never but say nyame I don't me go through application phase na minya
na unya wi
me was what tell say
so you
fund never
so you make a specific application into application na be no any you be reject it and as you be accept it don't be accept be am be amount based on the application you make by the recommendations recommendations by the medical doctors and number here try the review
because earlier okay say for sa yare na ye ka ho asem non communicable diseases no you cannot manage them you manage them meaning say yare because okay yeah they want to so after be 1 month home beto na you manage them in managing them no say me qualify through my application na bia me pressure yentimi into ase ye manage mobem boame manage ya tell say nyame beto nsa afre on this fund
so if it is part of your application your package you ben boa mo manage ako and one of the things that make us yes in the bill no be form ni say where's the sanru no ibetu aye bi organ here
okay long term
in fact medium to long term you be bio because your pharmaceutical industry ni enyini and we are encouraging them. And this government is prepared to invest in the pharmaceutical industry. Ne bin so wa over surgery. We are not praying surgery no be me no na be me ensa. E bia eye once. Ne aboa no waye. Nti eye based on the what be ba no. And ye be review, ne hu de be den, ye be boa wo. Se ne be ya enkoye dadwene. Emfa ma woni wabusuafo.
It is based on the Ejuma committee no, Professor Ite committee no you know. How much do we expect to spend on one person the application they go through? So based on that, because okay for a fund like this, no, you here to start it proper and start it well. You hear 300 million Ghana cedis near the Ashas here because we emphasize say nipa baku or will spend say 10,000 nipa no. Do we have that breakdown?
Okay, so on average, the who say I could to spend it about 53,000 Ghana cedis a year. So what at the moment ne adebi oye na wo shase na one shase na so baby kase and wa shase you never start. So at the moment the estimation say yen shase ngakra so we need about 3 billion Ghana cedis.
3 billion Ghana
cedis to start with for the next 1, 2, 3 years.
Okay.
Because there are other things I be to be able to be successful in this idea. Also, a lot of specialists.
Yes.
There's a vacuum. There's a deficit. Until I was say training no. Until I was saying who say you bet to me. Ama your regional hospitals no ya convert them to teaching hospital ya those training na yasa number no to take care of the patient. Nina is part of Nina is part of this particular program. So what I say in initial stages no we are looking at targeting about 3 billion for now. My engineer yakuya nimu nyina no ni ehwese ni be ni thinking outside the box just like national health insurance yara baako mienu miensa enai na eko sa na ye review tariffs no sa until me feel say
and it's also possible say depending on how it goes no medium to long term we can have say a dedicated tax handle for the fund.
I know person make am asem sisia but if it Ghana for
nyina get to a level
who say ade hu hia nti yenye bibia tesa then it becomes a conversation nyina di adwen ba ho ne aye eboa obi a if you say look Ghana ye wono enti say brochiri obi ada na obi obi ada na obi obi woti hoi wabusuam wo papa maame o fase uko o maame side e watententen uko o papa side e watententen obi a problem a nti men kasa wo mfa ho nti bia wo contribution kakra no e be boa wo asense eja bed ne ma wo nko a nti say sanka be pay about 53,000 Ghana cedis wo nko a de amani ba ko no e bia se wo tua e bia 1,000 Ghana cedis to contribute a e be e decide bed ne beden e be ba form.
We've been doing some work with the Dialysis Patient Omo Association. And you say in the latter part of Abain that no rain no omo ye arrangement be edema won. You drew him CCA. Is it still happening?
So other publications say me try and draw na me key statement baby say me say nothing of that nature existed and all that those and I believe probably you are asking this question flowing from Sanya man. Obi, and I'll tell you the background. I was not me a ranking member on the health committee. So there was a time at the final formula, the first national health insurance formula. After the main budget, I was with the national health insurance formula. Obi, the secret in this is that at that time, I'm the formula there was certain another year dialysis issue not very topical. There was absolutely nothing. Not the then government promised to say. To one among to come from the buy no they can say I dare to say you can want say man ya hwe budgeting and my dance for a year MPP for no more committee at the time into the committee insisted at the committee of the whole say monko for bibi and shame ni take care of the near share so kaya satana kolebu for some bill or you bear 2 million no say you remember that conversation into omo reference 2 million into omo koye no actually no no omo koye bibi say okay sa 2 million we no yem fan take care of omo below 18 and above 60 because na sa bracket omo no so to omo koyi sika e dey free corporate social responsibility mu e dey beka ho into omo ye na omo kodru ba bi no so skadi biaka into na ye san fan to aso nye ema amanfo. So it was with respect to the 2024 formula. There was no sustainable sources to deal with it. And a formula, as and when you can take something out of it or you can introduce something on it. So as I said, the BNU force will say, unless I do they are to swear, because the genesis of it, I bet that sooner. That's yam pet sustainable sources now, and that formula no, 31st December 2024,
sure.
So once Safo money ebe wuno, it means that
new okay.
It's a new formula. You cannot say it's part of the national health insurance. But let me continue.
Okay. And that was the point.
That was the point I was making. So we don't have that thing until we agree
on the new
formula. What we are doing now is statutory. backed by law. You can't take it out.
Yes.
You don't have the option.
Which is Mahama case.
No. But at that point, it was not like that. Look, I'll tell you the truth. At that point, I didn't know, you know. We were compelled to continue.
Yeah.
Because, and even today, I mean, CEOs are calling me and all that. They called me because at the time, no one said, near any boards in place. So it was Ministerial Directive. And I had to instruct them to continue.
Outside the expiration of the formula.
Yes, I had to instruct them to continue. Would that need my instructions to continue?
No.
So that was the point I was making. It is you know. It's not subjected to your discretion. They best spell it out everything. Yeah, pass it. I football. So that's the difference.
As we speak, 2025 formula no. For NHIS. Because of Mahama case, no, in the new formula, no, you will not incorporate dialysis treatment in that formula.
Okay, so that's another debatable and gray area.
Okay,
it's a gray area and debatable because we have now envisaged it at the moment. You bet media can't. National Health Insurance
okay.
And medical can say adia National Health Insurance so cover bia no so no
cover. Yes.
So it's up to us to take the decision. Say you fantastic. Me nyina no kopim ho say kwan be fa so be sustainable Ghana for benya yarehwe. But the make what say nti no adia e wo say den manage.
But at least the form of the package need be ho.
And they're not until, if anything at all, will not vary to the disadvantage of the patient. No. Will not vary it to the if anything at all, it should be
benefits. But it is to say for now, sir, 2 treatment a week, no?
Yeah.
Would continue.
Will continue for now. I bet continue computer maybe we formula no near declare and I say Yama new directive say same year we will not vary it at the moment.
Oh, okay. Because at the back where my starting your year into Obasha under the Ekosiisen impact project near Niomo Yane your friend is saying kidney patient.
Yes.
Started because on my who say I buy afa some dialysis treatment twice a week.
Yeah.
Or more here more than 2 no? You have to find a way of funding last one akano. But before they get onto the machine no omo panie mienu bi omo ba akoye iron shots bi omo take it 2 shots. And I think for the 2 no you spend roughly be 300 cedis for the 2. It be brainers as kan ko munya. You know it omo be 2 enem yes okay they near for and kasadi I think first, a month ago, they donated 50,000 cedis at the Mawon to take care of patients, the poorest of the poor. Omuntimin tria for 2 shots. No, it may be medium to long term. I don't know if with Mahama case, all of those things can be considered.
I think will come into the package.
Yeah.
With Mahama case. So, for example, say medical kind, you bet me decide say, okay, when a dialysis, no. National Health Insurance EFA. Let's leave it. National Health Monfa. The EFA not like this short no. Yes, so we will think through it. I didn't need tobacco for trim. So that is the operationalization of Mahama case.
And that one makes sense.
Yeah.
That one makes sense. The other thing so would be say almost a patient now call private facilities. The argument is say I buy a public facility ABR 400 cedis per session on the dialysis machine. I might make it 400 now available to private facilities. It's a member private facility. I buy them is 400 no. So private facility need 1,000 Ghana. I will top up the 600.
Yeah, a sound argument. Just like I've already indicated.
Yes.
Obia, with respect to Mahama case, you go through some kind of applications.
Sure.
You go through the applications, you need granting mawa, and then whether public or private, you are entitled to what you are entitled to. Yeah.
Okay. That one makes sense. Ekosiisen, the Health Minister of the Republic of Ghana, the Honorable Kwabena Minta Kando, and Aidin Komo, or MP for the people of Joaboso constituency in the Western North region. Who are doing show question be emana 0548 443 523. Lot of your questions already coming through. 0548 443 523 0548 443 523. Honorable my one other critical idea you hear in the health sector, infrastructure. Inti was say hospitals no yes meaning say monsoma by mubesibi any ade. Really, what's the government's position on Agenda 111? The position was anything. Well, it seemed the budget was a bit silent on it.
Obi no nyanyawa no de bibie gugumbi. Bramindi Mahama kenko. Anyway, yes. So Obi yenyina yenim Agenda 111 say isi hyase ene bibia akwakowie. It's not undeniable fact say your deficit in terms of health infrastructure. Yes. Na to tell you the truth, a quiet fast why Agenda 111 na enye.
A quiet more fast so
no na enye. Let's call a spade a spade.
Okay.
Here infrastructure. Na the omoye ne say almost see the previous government the previous government I can say see 111 hospitals. Obi so obi see 111 hospitals na ukresika kra na nka be ne kakra. Nti bia why 10. What you say from Ghana for come no san for 10 beam and even if 20 nanka aye kama
yanka yen stagano no okay
nti ye sha say no mo say o be wie between 12 to 18 months no ma wie di won komo hasa. Unfortunately, at the point in time, His Excellency the President then Nana Dankwa Akufo-Addo Bekacha say he will hand over the 111 hospitals to Ghanaians before he leaves power in one of the zones. Unfortunately, Omo handed over, not a single one of them was in operation. So what I say. But so and previously they were under the presidency. They said they are back ministry.
Okay.
Agenda 111 project. They are back ministries.
Okay.
Do share a car, sika, in fact, the total sum was between 1.7 to 1.9 billion dollars.
And they are thinking so far. Budget for the entire
project as at the time.
Okay.
It is a share. Sika almost sank into Agenda 111 and some move free office was about $400 million US.
Okay.
The interesting aspect is that some medical share see a share yes taga and got $400 million and to me you could maybe more than 20. I come in name no come. But because of the way I hear into no back operations is here.
Even though my commission means
that's another area. So my main frank and so what we realized was that His Excellency former President Nado man the last state of the nation or say on the 5th of December 2024 or commission binom.
Yes.
Into the argument has been is being commissioned and is in operation. And His Excellency John Dramani Mahama the first state of the nation or can say not even before the non stakeholders be credited in Komo. I can say not a single one is in operation. But to you.
Yes.
Man for a doubt, I mean, they've called on radios, freaking I'm so okay. And you see, in government, when the president speaks, it's a policy direction.
Yeah.
It is up to you, the sector minister, to follow up. But what I said, the president can say you and I have to take it up. It's now some question whether or not they were in operation. And unfortunately, none of these three facilities, commission here, the president call hono, commission here, in operation. At the moment, the area say, President I directly clearly say, remember you audited the whole project.
Audit
of the Agenda 111 project. Into no blueprint as to the way forward.
And timelines for the audit, the
timelines. So, but I don't think it's for public consumption.
Because sometimes the audits, and we've been here before. I remember Cocoa Road's audits. No,
that's true.
2+ years.
That's true.
Na omunye. By the time we went back onto the roads, na contract variations ne ade afia was say ekototo way fufro na say
yes, I agree with you, and I can assure you and confide in you, although I'm speaking on air, but I don't think it will take more than 3 months.
Intake for the audit.
For the audit.
Good.
I don't think it will take
following weeks. The way forward will be clear.
Will be clear. Will be able, and we'll make a preliminary pronouncement that Obek take the private sector on board. That has she a charge for catcher one. Say we are going to look at the PPP.
Okay.
So what I say. For example, Oshia charge for catcher almost say agenda 1 is ready. If they are interested, they should speak to the health minister and then see the way forward where they can partner government. Because we call hospital a Roman for there.
Yes.
We call hospital SD for there. So we are partners. We call health professors are more in our body to Omoka.
Yes.
Until we are already partners. Until we also want to bring them in, just like you will be more. And also, no, we have so many. I don't want to preempt what will be coming.
After
and the audit, no. Nyema be film abano and so be boy and the clear direction no a horn me person meja no with respect to audit no.
Fine. One other thing me person me busane say, why was government expecting say, because you made a point, said the commissioning of the 3 now was done on the 4th of December.
Yeah.
3 days later,
yes.
You know, say commissioning the hospital is one thing.
Fantastic.
Recruiting human resource to make it operational is another thing.
Fantastic.
That could not have happened within the period.
So they shouldn't have done that in the first. And let me tell you one of the policy directions we have indicated this time round. This time round, it's clear. His Excellency direction, Mahama has directed, say, main commission be ready to be operationalized.
Okay.
It is the only time Obeka say we nipa benya so mfaso no hey time I meet me akwa yare. And in any case, my main case asem we nchro. 3 facilities are call even the engineering aspect, civil engineering aspect na enye complete. No munye. Although I admit say na bi no wa drew far, I mean about 70%, 75% completion, but no munye. Ebi na equipment ya sign contract mo provide or multi supply even more than 10% of the equipment na baby sebi ube kono baby okwa labs nko ye
na say me en sape minim trade minim Ahanta West and one other district
in Ahanta West yes for example ye kwa labs on ekwa no munye
Ahanta West.
Yes, I went there with the media. Labs munye collab was so often near the ade omunwe. So I don't want us to divert ebi o why equipment ne mai ebi o why equipment na bagu ho. What I say ebi o why equipment ne bi aba. In any case, equipment should even be the last thing that was a back at the enemy.
Yeah. Also my
baby you know into baby am call equipment the place when safe. So let us even not divert that attention in the first place. The wampanya can say kwan be the first one Ghana for benya so mfaso because yesika Ghana man yesika ene dia kosim
in the side 3 no ebeka auditing.
Yes ni nyina aka
mo de beka auditing ni nyina aka come to isolate those 3, finish it and make it operational.
Oh ye ka say ye auditing na say ye blueprint and not just say ye.
Okay.
We may even try to do more than the 3 you are talking about.
Okay.
But they can so that be inform a decision going forward.
Okay.
But what I say, and I know just say because you're auditor, just no and I said no. Yes, I know audit must say. Until be no, it be a because oh, you feel say back me no say 9 enum edu. I know the yamfam fabinkum. The next 20 yamfam fanifa. The next win yamfam for your name. The next win. Until ni audit no and a better.
Can I say because of the magnitude of our Agenda 111 project in the Andawo as health minister, you will not focus on starting new hospital projects and rather complete, because these are many hospitals.
Yes, we will focus on it, but as and when it is necessary, irrespective of the Ekosiisen, you will never be and also exceeding necessary. For example, I'll give you one of them. We used to have 10 regions.
10, yes.
There was 16. So it means that there are 6 regions without regional hospitals. And even in some regions, come more regional hospitals, no, those regional hospitals have been elevated to teaching hospitals.
Yes.
So that's it.
You also more regional hospitals.
But they make what I say. Until we look at it, near balance it at the end. And now let me tell you one thing. Obi, you can say infrastructure. So ya suyasan ye yebetimi abode one ho ban a bia yebesi 1,000 but enkusi aga. So the most important thing we must begin to do and they say dear one e kwan be na fa so ya ye ni abon ho ban ye obi ye ka hospital ye no ne dan si ho no ni pe ye adwuma wo mfidie wo nure wo ho e na ye hospital no. I agree and admit say aban ewa na mo bebre a wose yetuo but e bi mu wo ho a ye hia ban. And I hope you agree with me. Obi me pache wo nkotojogu form ahobrase mu a uhia aban ansa na wa clean hospital dabi uhia aban ansa na wa addo hospital dabi uhia aban ansa na wa paint hospital dabi uhia aban ansa na wa treat patient ye no. So we must begin your facilities bi wo ho a ni semi na betimi atra haka udu wa arabe ho ubedu baabi no na ceiling na papai ubedu baabi no na eliki. So we are waiting for a buy man be face roofing sheet na eliki no. Meanwhile in some of these facilities a generated fund, I agree, let me admit say omo charge as much as omo charge your private facilities. That is
that has been the counter.
Yes, but at least yenya bibi kakra. How are we setting our priorities?
Is there a policy governing how IGFs should be used in Ghana in our hospitals? Policy war?
Well, it depends on the sector how they will ensure that yeah policy be a sabi legislative.
Okay.
But what I say, nti ebi o wa ombetimi atrase ne yaka say okay this we no ye de kwakoto welfare mu ayese. But yakopa daroma bebrina ne me ya adwen say we need a change. We need to reset the system. Nyamia daroma. And of course Obi, let me say our system be na ekoswa for some time now balance also by reset so be change. You won't have it easy.
Easy, sure.
You meet resistance. I mean it's natural. But I know no interest say also abamubu. It means that just only need that so only aniswade hunu bia. So that's here. You have to be humble and explain what you are doing to the people to understand, to buy into it, to do it. So clearly, Obi, I'll give you another example. I buy to infidie near the Ama hospitals.
Yes.
And again, let me admit, say, I'm not charging that, but a generative BB.
Sure.
But I'm a buana. The other thing I was buying continuously. So, Safidi say, yeah, I buy some every repair and now say a replacement. So there's a clear policy directive. If you local, none on which you share, Dr. Funyina, I mean the regional hospital medical doctors, ya say if we nekono, you pay account be a you bet you as a kukum IGF no sika you be generated from equipment no you be kukum nsa equipment na buy magic preba e mankind there be
into maintenance issues
minister e magic preba. It is still for that facility. You can only make good use of it. Abra will say, would you quack to fidie na be an affidie and the hospital as a queen ye? Okay.
And son of what me at
a canon. I say reference to again. Obi do baby no. Not sabi painty cry be painty a dino and so I watch a bidding. In general, so capes infrastructure no and also I can say we are and your dear. Maybe try crying. No matter say, no use 10%, 20%. So they be affected the running, the day-to-day running of the hospital. So, into now, Director General, Munko Transi, come back to me. There should be a percentage of the IGF. About going to capex, maintenance, paint. Until I be cross, everybody do baby no sabi. Cabo square friend say, in 10 time. And the higher black. I'm not making this up. People know I'm not. Look, Obi, Obeko baby no. You say you surely want the washroom ya tum. Hospital. Obedu baby no me call baby. Me so mumie adenma menhwe because of the nature. I want me obedi me call round 2 kilometers. Me baby ayo. Oh, Papa so pam woman so. You know we must all buy into it. There will be a while, yes, buying our responsibility. I mean, again, the medical doctors are sacrificing so much for this country. Some of them, the conditions under which is something else. But what I say, they are sacrificing so much for this country. But Mijidi say, I was saying, you boom. Na you to me a balance in your man. Mijidi say,
and you've given that clear directive
that
sector
it's been established
on how I be use IGFs.
It's been established
to make sure say pressure be bring central government.
It's been established. So the fine details no so ne be ya enkoye say made detective from the top on into no so mo ankodwe na momfa memra na yenhu going forward no.
Some have, and I know you personally, I know the passion you have, but Ebia criticizes say your style is too aggressive. Do you agree?
Well, depending on who is criticizing you, I can agree. I'm very passionate about whatever I do. That's me. And I believe that if it must be done, it must be done well. That's me. I'm coming from a very, very humble beginning, as you know. It is only by the grace of God. And I did so I always think that I owe the system. I don't have to just pass through a system like that. I have to contribute my quota. Nti obi bepe, obi mpe, me panso, me perfect human being. But what you say, nti obi bepe, obi mpe. But what is important is that the me no, mfaso ben, nebe baso, and na ayeme me. And of course there are people. I learn and I listen to a lot of people. Oh, kwabna de we yepa yetawachi nemu yenise. We I mean I listen to people. So what I say, there are people who also call you, oh, the way yepa. I mean no and my uncle should be say at least the way you nipa ni so. So what I say, any nipa nya na edi watem. No matter what. You know, but I can assure you, Obi, you better the from the a bit to me beer. I can buy beer, give me beer, Nenso. So, what the nature of our economy now? And your person, and your beer, but on the Tamale issue, what's the latest? Only a hot doctors next year. Oh, Tamale issue, I don't want to go into details. They make my kind say, they make my kind of Yakopon Daruma. Yes, yeah, Asre, Atoyum, Anyakopon Daruma. They are working, be anywhere, so I don't think I want to go into
I'll grant you that.
Yes.
My main kind message is Kakrana Fe. I know, say, we are ranking, no? We are ranking one thing, was your okay, even before this question, no, sir, nan saying
surprise visit,
over to us, and I will hold you on.
The surprise visit in the metro, so
over to us, the same style with the media, any media.
Some make cast style next year and you surprise me.
But I mean, there were some hospitals, some of them under NMS, under your friend is saying Eurojet, any idea now. Every time I now a ranking member.
Yeah, that has been my style, my surprise visit.
Yes, I know.
It has been my style.
I know. But all of those hospitals, no, you are complete.
Baby, why are complete?
Sir.
For me, I think Baku, the Indian complete here. Baku be
a Yidiano.
Baku be
Dominic, Mohodi, I bet if you don't know where we
the Indian go, baby. I bet if you I bet if the end I don't know what to be doing. I don't put the baby one else is say bugu.
Sir, you have to pick it up.
You pick it up. I'm saying me buy office you contract another. Mamine Nakasa.
Okay.
I
think so far it's the only outstanding one.
Yes, I think so.
Yeah.
The enquire actually cry, I don't know. The ministry the players are cooperating.
Very well.
The players are cooperating.
Obi, congratulations to the Health Minister, Kwabena Minta Kando. We pledge fully to support his cause to reset the sector from the convener of Ghana First. And the way, Abba. This one says, Obi, kindly pass on this information to Honorable Akando that the eye center at the Kolebu Teaching Hospital does not work during weekends. Is he aware that they only deal with emergency situations? There is too much pressure during working days. In fact, they have huge deficits on doctors who perform surgeries for cataract in the way Kolebu Eye Center, Osio weekend. That's one thing. Where's the Obi? Did you notice how the Honorable Minister struggled to answer the Joaboso question? Oh no, that's me Musa Joaboso. And let me Musa in relation to say, how would one access Mahama care? I only use Joaboso as an example. Where's the Obi? Agenda 111 has regional hospitals as well as psychiatric hospitals in the 111 project. Okay, then they factored 6 new regions, no, at the account, if I get that message right. Well, so Obi, I like the question about the uncapped NHIS fund. If this is actually Mahama care, why should they stretch the funding sources to taxpayers' money to build someone's legacy? Mahama Cares ni AKA, also known as Obodin Ankasa, a Ghana Medical Trust Fund. That's the name. Inti Mahama Care ni alias inti me pacho. Let's get it straight. Gastiman in Brekum Medase Papa nonetheless. We say Obi, good afternoon to you. The health minister needs to be commended for his style. You may disagree with his approach, but the nature of our hospitals and what people do there only calls for some of these styles to be used. At least we have seen some changes at the Tamale Hospital. I want to know his strategy to stop the mass brain drain in the health sector. It is a tickling time bomb. Godi in Tema. Honorable, I think I have to give you the opportunity to answer. Brain drain. Brain drain. It's a major issue.
Obis brain drain we can never say a whole
topic.
And you na a brain drain.
Okay.
I'm say you health professionals like training or move brain.
Yes.
Our move here.
Okay.
Even if we decide to take our maximum optimum. Still, you be move fear. So what I say.
Yes.
And now there are a lot of factors I am for to coin flow my. A be a while, sabi baby no. Health professor I'm suffer the sacrifice. Sabi basic equipment called the bay man only be into your money a job satisfaction.
Yes.
A be a while sabi ya won't chrome at tiny chrome. A crash on train be the same me crossing. You can some more crassia. Ding emano.
Yeah.
So what I say.
Yes.
E bi so wa o hwe ne ho say akatua meji. Da ben na mesi dan ene me ma ene me we akom. Ene me o hwe de obenya no abrochire na ene me ko abrochire. Obi so wa kunu wa ya adwuma man ni sa wa invest in the country get say DDEP you twa haircut ne sika nyina ase nti o consulting room kra na ni nje obiso free o manim no call reorganizing no sign back. There are a lot of factors nti enye ni nyina na minister for health no who control. Some of them has to do with even the economic conditions, the prevailing economic conditions.
Yes.
So what I say now until I will say, you to me absorb the maximum we need as a country, try to improve upon the economic conditions. Try say you bet me you be ritually your hospitals, the facilities, no. So what I say. I feel so. A quite many be for so you bet me amount for some incentive packages.
Sure.
So to be a while you be posting a quite crass no. Sabi let's just declare any the kaka home. So it is one of the government policies implementing how we implement. So obia ebe postu akwa krasi a obekon your friend underserved areas, underserved communities. Say you bet you about 20% of your basic salary at the account
as an incentive.
Yeah, resa na we nyina no. We nyina kra na we kra na uti obi even sabi $10,000 a month kra obi beko. And also say ne be no. You see government per se facilitated the migration. We want to control the narrative ourselves. ujitumo wanyentu we go anyway. So what we are going to do is that we are going to engage at the level of government to government. In the Germany, for a lot of countries on show interest. The Germany for no say omuhia nurses every ha. Ye no ma buy no ebetena senia ye hyehyeye.
Number say the bitimi
ya momo. Ye be ekwan be fashion betu omoka because ebi me come asetan other countries mu kire wa. It is because government is not involved. And we want to take control as a CIA no nyame ada Roma. Other countries we are linking, we are writing to them and they are responding well.
Okay.
Nti ebedu baby no mkwa betu ya be invest in our healthcare training be investing in it need training more. No mo so mo yin mo krofo ameden omo epe. Ye what typical example Barbados, you know mo bibi etisa. So we want to contact more countries and no after absorbing the optimum now in here as a country no. So as I said, no more fear no more adwuma no. You think outside the box say can be a because after all remittances economy. No.
It's true.
It's one of the way forward. And also
nurses backlog no saying the woofy.
Oh baby. Nurses backlog. Apart from 2020 in the current watch it 2020, and let me tell you this, let me put this one in the public domain. The former regime, some 15,200 nurses
in the year
2024.
2024. Okay.
So okay. Out of that, or more attempted about 13,000. Out of the 13,000, Obi, I'm saying on your platform, say up to now, I can say only about 2,000 something they are mechanized or payroll.
Out of 13,000.
Out of 13,000. So it is the year, the account about 10 to 11,000 is a burden of this government.
They've been engaged.
They've been engaged.
Payrolls.
Yes.
And they've worked without payment.
Some of them. They are close. Payrolls.
You have to do that.
You have to.
Now, Masaya fa backlog nibi. It is a worker from 20 million say 2021.
2021 of year, 2024 2023 of year, 2024 of year. In fact, some of the cadres and pharmacists for Kromosi, the last recruit me is about how many years? About 8 years in you could be that. The pharmacist. Allied and they were in my meeting and rankwa many GMA for your meeting, many nurses association for your meeting, many allied for your meeting, and rankwa. And the allied for the catchers are Monsono about how many years? 5 years ago. No recruitment. The pressure is not easy. I'm telling you, Obi. You'll be shocked. Sometimes if you don't push us like you are doing today, I won't come out and say some of these things. What I will be engaging myself or what I should be thinking about is to how I can solve fix the system. No?
Yeah.
But when you access like this, I'll see a candidate to Abontina Ghana for follow what we are doing. Into the pressure in the system, Obi, I can assure you that they're very high, but by the grace of God, I think that it's going well.
Recruitment.
This year we are dealing with the Makacha for now.
So 13,000.
We are the bit about it for now. We are no matter what. Messages
be raba ye nuanu me JoyNews nso ehia and the we news and there was a man for so take good news in Mahama.
I agree.
Since ye beja na one JoyNews for akodi nkomo